Staying healthy in Blackpool is a challenge.
In some of our wards, people are only living until their very early 50s before they're developing significant long-term conditions.
Getting hold of healthcare hard.
I never thought when I'd be ringing up that I'd have to wait 4 weeks to get an appointment just for someone to look at my spine. It's scary.
For Blackpool's GPs, the workload has become unmanageable. Patient lists have ballooned.
We are doing our very best, but we can't put appointments in where there aren't appointments to be offered.
The UK is clearly gripped by a crisis in GP care right now, but research from Newsnight suggests that that crisis is being felt even more acutely in areas like this that are already struggling with multiple deprivations. The figures suggest that places like Blackpool have far fewer GPs per head of population and far lower levels of satisfaction with their care.
And it's places like the Revo estate where that dissatisfaction becomes clear. Talk to residents here and you'll find many who've lost faith in GP care altogether. This is the second most deprived area in England. Every one of the people I spoke to at the Revolution Community Centre had a story of being let down.
You're always encouraged if anything that you suspect may be cancer, so I found a lump on my lower back. It was painful. I phoned up my GPs to get an appointment and they suggested it might be better to go to the walk-in centre because I'd get seen quicker. They offered me an appointment, but it was in 3 weeks' time. They did just pack me off with some painkillers. There was no access to a GP, there was no referral to anybody else.
I tried to get an appointment as my scoliosis has got worse over the past 2 years or so, but I had to wait for 4 weeks in pain just to see a doctor to tell me that they were going to put me back on my painkillers and to give me some yoga exercises to do.
That's pain and that's worry. Does it also stop you working and living?
Some days, yeah. Some days I can't get out of bed.
It's very hard to get an appointment. You can spend hours on the phone trying. You're not allowed to go and walk in there no more. So you could wait 3-4 days before you can actually put in for a prescription, see a doctor. I just sit there crying. I think, what's the point of trying a phone when no one wants to help you?
I rely on my volunteers that I have that work with me.
Christina is a youth worker at the centre. She says local kids often come to her for medical advice.
They come and tell us, they're like, Mum tried to make me a doctor's appointment for this, but we haven't been able to, so I don't know what it is, but it's worrying me. Do you think it's this? And they are quite worried about it. And that's
they
kids.
ask you for a medical diagnosis?
I've got kids that are from 7 to 13 coming in and asking, going, do you think I've got this because I've got this rash on my arm, but Mum can't get me into the doctors.
Whatever ambition the NHS may have to create health equality, the fact remains that one of the most important things that poorer areas have much less of is health. People are sicker, they become chronically ill younger and die earlier.
We struggle to get GPs to come and work.
Andy Knox is a GP and Director of Population Health for the region. He says it starts with where people live.
The housing quality is poor. What that means is we've got a lot of damp housing. Now we know at least 20% of our respiratory beds this winter are going to be filled with people who are living in damp housing and therefore getting lung conditions that if the damp was sorted wouldn't be there. Some of these big Victorian houses of multiple occupancy, they have a lot of people living in them, so there's cramped spaces and the houses are cold, so you've got more disease spreading between people living in the same houses together. And because of houses of multiple occupancy and lots of people, it can feel quite stressful. That then also increases the mental health issues. And here in Blackpool, we've actually got the highest level diagnosis of depression of anywhere in the country.
While demand for doctors is higher in poor areas, the supply of care is much lower. Over half a century ago, the GP Julian Tudor Hart observed, the availability of good medical care tends to vary inversely with the need for it in the population served.
GPs in more deprived areas tend to be relatively underfunded. Their GP practices are underdoctored compared to GP practices in richer parts of the country. It's something that we've known about in the health system for a long time. We call it the inverse care law, where perversely the people who most need high quality health services are least likely to get it. And that plays out in general practice today.
So Blackpool's health needs, as with other poorer parts of the UK, are deeper, more acute and more complex. As the NHS struggles with a record backlog, rising demand, soaring inflation and a full-blown staffing crisis, there's new evidence that places like Blackpool are falling further behind. Newsnight has commissioned research from the Department of Public Health and Primary Care at Cambridge University. The data we've uncovered suggests a deteriorating situation. This graph shows how the number of GPs per 10,000 patients has changed over the last 7 years. The top line on the graph shows the situation in the most affluent areas, the line underneath the most deprived areas. Since 2015, a gap between the doctor-to-patient ratio in the richest and poorest areas has widened. It's fluctuated in size since, but our research suggests it's grown this year.
There's quite stark inequalities about how GPs are distributed across the country. And actually, when we look at that data, we see that inequality is actually widening. So to give you a bit of an example of how that's changed, so if we look over the past 7 years, practices in richer areas have gained, on average, about 1 day a week of additional GP time, whereas practices in poorer areas have actually lost about 1.5 days of GP time.
According to our exclusive research, the experience of these Blackpool residents is typical of GP care in poorer areas. Not only are there fewer GPs offering fewer appointments, but the care, as measured by the CQC or Care Quality Commission, is on average of a lower standard. Research for Newsnight by BBC data analysts suggests the quality of patients' experience also correlates with levels of deprivation. In other words, the poorer an area is, the lower patients rate their overall GP care. Surgeries are harder to reach on the phone, and when they do get an appointment, patients in poor areas rate that experience lower than those in more affluent areas.
Last year was about 8% difference between rich and poor areas in terms of patient satisfaction. This year it's increased to 10%. But it's not just patient satisfaction, we also see the same sort of pattern with things like CQC ratings. So we know that actually practices in poor areas tend to have worse CQC ratings than practices in rich areas. So to give you an example of that, if you take an average rich area, about 6 in 10 of those practices would be rated outstanding according to CQC. If we take 10 practices in poor areas, about 4 in 10 of those are rated outstanding by CQC. So it's not just patient satisfaction, but there's a broader point here around the quality of general practice.
Newton Drive Health Centre, Emily speaking.
Newton Drive Health Centre in Blackpool is rated as good by the Care Quality Commission.
Come in.
Susan Green is a GP and partner. She says criticism of GPs, particularly that idea that they're being lazy or uncaring, is hard to listen to.
It is so devastating to be told that you're the problem. And you have to just say to yourself, I know the reality of what I have done today. I know the reality that if I do crumble and I can't do this anymore, that's another 80 appointments a week potentially lost.
It doesn't work.
The problem, she says, is the almost unlimited demand unleashed since the pandemic.
When I'm in my room and I'm seeing my patients, I feel that it's going okay. But then I hear what's happening in reception.
I don't have any doctor's appointments left.
And that's when you realise just the need of people wanting an appointment against the capacity of how many patients you could physically fit into a day and still be safe in doing it. And that's a really hard thing to reconcile. You know, you want to be able to help everyone that needs it, but you simply can't.
One of the problems that places like Blackpool suffer from is recruitment.
If you were going to choose somewhere as a GP to work, why would you go and work in a place which has potentially more issues, more stress, and less finance and resource available to you to kind of deal with the issues you're facing, alongside, you know, our public health services also having been cut really, really significantly, particularly in our most disadvantaged communities.
GPs have got a choice of where they work. We put an advert out and literally might get someone phone up and say, oh, tell me about the job, but nobody actually applies.
It is perhaps not surprising that care is measured on average of a lower quality in poorer areas when there are, on average, fewer GPs per head of population. But there is another hugely important factor: less money.
Part of it is to do with the way that funding is allocated to general practice. There's a formula that tries to take into account differences in the population size, in practice characteristics across the country. But actually, when you look at that formula, it doesn't really take into account, in the way it should, deprivation and the additional work GPs do in areas of high deprivation because of greater healthcare needs.
GP practices are independent businesses that are contracted to provide care. The funding formula rewards them for services like vaccinations and repeat consultations on long-term conditions like asthma and high blood pressure. Practices in poorer areas find it much harder to earn these extra payments.
When we look at the data, we find that practices in richer areas tend to get more money per patient, and practices in poorer areas get less money per patient. To give you an example of what that looks like, practices in richer areas would get on average about £159 per patient per year. Practices in poorer areas would get about £149 per patient per year. So about £10 different per patient per year.
Dr. Green says many of her patients are not focused on health in the same way that patients in richer areas are. Health is sometimes buried under all their other problems.
What's really challenging in this area is that we know that a lot of the things that keep our patients well are not within the remit of a GP. There's so many other things that need to be fixed or helped that their priority is different.
What was really striking on our visit was that no one seemed to think the stresses on the system were about to ease.
It is absolutely outrageous what people are experiencing here in Blackpool, both the GPs and the communities. It's not acceptable. If we see another funding squeeze into our public sector again in this next period, we are going to see devastation.
The pain of a struggling primary care sector isn't spread equally. It's places like Blackpool that have already suffered most. And with the government warning of eye-wateringly difficult spending decisions to come, the situation might well get worse.